video is intended for faculty purposes only and based on the Evolve Performance Checklist skills and NR 224 National Rubric. Certain equipment or steps may have been omitted. Performing Trach Care. Step 1. Assessment. Identify patient using two identifiers. Perform pulmonary assessment. Auscultate lung sounds. Assess patency of airway and condition of surrounding tissue. Place pulse oximeter on patient. While doing so, assess the patient's knowledge of the procedure and answer any questions the patient may have. Step 2. Planning. Obtain assistance from available staff if necessary. Assist patient with the appropriate position. Place towel across patient's chest. While doing so, you may explain the importance of the patient's participation during the procedure. Step 3. Implementation. Ensure that all equipment is available and functioning. This includes suction tubing and ambu bag setup. Now you are ready to begin trach care. First, perform hand hygiene and place appropriate PPE. Remove lid from sterile saline and place it upside down on the table. Make sure to lip the bottle. Next step, remove or place the trach collar to the side so that you may remove the trach dressing and inspect underneath the faceplate. You also should inspect the balloon and ensure that the cuff is inflated. You may replace the O2 device and assess patient. You can discard your gloves and perform hand hygiene. It is important to assess the patient's cardiopulmonary status. You are now ready to open your trach kit. Please put on your sterile gloves. Next, remove the sterile drape and place it on the bedside table without contaminating it. After doing so, retrieve your supplies from the sterile trach kit and place it on the sterile drape. After removing all of your supplies, pour saline solution 6 to 8 inches above the tray. You will fill both basins. You will now move your trach collar and with your non-dominant hand, remove the outer aspect of the tube to remove the inner cannula. Drop the inner cannula into the normal saline and then replace the collar. With your sterile hand, use a brush to clean the inner cannula. After removing the secretions, rinse the inner cannula with the normal saline by dropping it into the basin. Remove the trach collar with your non-dominant hand. And with your non-dominant hand, dry and replace the trach site. The trach into the trach site. After replacing the trach into the trach site, hyperventilate if necessary, otherwise reapply the oxygen source. Then use your cotton-tipped sterile swabs and gauze to clean the exposed outer cannula surface and underneath faceplate. Clean in a motion from inward to outward, using your dominant hand to handle the sterile supplies. Each swipe should be with a new sterile swab applicator and then disposed. After doing so, pat dry with gauze. After cleaning underneath and over the faceplate, you are ready to replace the trach ties. During this time, it is important to assess the patient for any respiratory distress. After replacing the trach ties, insert a fresh trach dressing underneath the clean ties. Position patient comfortably and evaluate respiratory status. Replace any O2 devices and remove and discard gloves. Ensure that trach ties are tied and perform hand hygiene. You have now completed Trach Care.